morning friends, myself Dr. Dhaval Dharani. I am working as an infertility and fetal medicine consultant at Paaranu Women's Super Speciality at Gujarat, Surat. Today, as a part of the public awareness campaign, we are starting on the lecture on the fertility. So first of all, you should know what is infertility. Infertility means inability to conceive. When any couple after 1 year of active married life, they are not able to conceive, the couple we call as infertile. There are two types of infertility. One is called primary infertility and another is called secondary infertility. So infertility, what are the reasons for the infertility? Basically, there could be four main types of the infertile reason. One is we call as a male infertility. When in the couple the male has a problem, we label in that infertile couple it is due to infertility due to the male reason. Another group of the patient is where there is a problem in the female or the female partner or the wife. We call as a infertility due to the female factor. Third is unexplained infertility. Unexplained infertility means male factor and female factor, husband and wife both are normal, still they are not able to conceive, we call as unexplained infertility. And the fourth group, which is less than 10%, where there is either some defect is in the male partner and some defect is in the female partner. So a combined factor are involved, that is the fourth group in the infertility. Now when couple should visit the fertility center, as I told you, when 1 year after of the active married life they are not able to conceive, they should visit some fertility consultant. So what are the basic steps involved in the first to find out the reason for the infertility? First we have to find out the male factor. So in male factor, the semen analysis is the most important thing. Among them, three factors are most important. One is count, second is motility, and third is morphology. So count, the cutoff is given 15 million per ml. So whenever the count is above the 15 million per ml, we call it as a normal semen report. And whenever the count is below 15 million per ml, we call it as an abnormal semen report. And the term is given by a fertility specialist is oligospermia. When the motility is below 32%, we call it as an abnormal motility. Term is given for that is the asthenozoospermia. And third factor is a morphology. When morphology, the cutoff is given by WHO is 4%. So whenever the morphology is below the 4%, we call as a teratozoospermia. So whenever the male partner has all three combined defect, we call it the oligoasthenoteratozoospermia. Now same like in female also, the three factors are most important. One is the uterus, second is the fallopian tube, and third is the ovary. So either any one of this has a defect, they are having problem in conceiving. So either any one of this is in any defect, they are difficulty in getting conceived. So how we can know which factor is having problem? So first in female we just do the simple transvaginal ultrasound. That is the first and foremost basic investigation which we do. In that we in 2D images we can know the structural abnormality in the uterus or in the what are the antral follicle count in the ovary. Regarding tube we cannot know in the ultrasound. So whenever the structure, there is no any structural abnormality and other things looks normal, antral follicle count, then we do the basic hormonal test like thyroid hormone, prolactin hormone, and anti-mullerian hormone. So these are the first basic investigation of the couple. For husband, the semen analysis, and for the wife, just transvaginal ultrasound and few blood investigation. After that, we came to know that where they are having the problem, and according to that, we should plan the treatment. Regarding the treatment for the infertility patients, there are different modalities are available. Like IUI, we call as intrauterine insemination. Another is IVF, because we call as in vitro fertilization, and third is the ICSI, intracytoplasmic sperm injection. So how someone can go for such a procedure? We decide on the parameters which we have, like that what are the basic problems in the male partner, female partner, or the combined they are having any problem, or the past treatment which they have taken, or the past consultation or past whichever the procedure they have undergone. So IUI, what is IUI? IUI is intrauterine insemination. That is the first basic procedure, or we are suggesting the patient when everything is normal. In IUI, what we do, we first give the ovulation induction drugs, either tablets or tablets plus injection, and our aim is to get few numbers of good follicle, like 1 or 2 or 3, and when the egg is mature, we give injection for the egg release, and after that 36 to 42 hours later we do the IVF procedure. In that we collect the semen sample at our center, and we do the semen processing. We are using the cultural media, and our aim is that base sperm which are means motility and morphology is good, we say means select that sperms through the processing centrifugation process, and then with the cannula ultrasound guided we put the semen sample inside the uterus. This is a procedure is a intrauterine insemination. It's a very cheap procedure, it's not a costly procedure, and ideally 3 to 6 cycle of intrauterine inseminations are suggested all over the world by the authorities, and the success rate of IUI is around 15 to 20% per cycle. And whenever the cumulative success rate is, it means when we couple goes for 3 to 4 cycles of IUI, the success rate reaches to 30 to 40%. So IUI has a good success rate in the couple which are not having any other difficulties, because IUI bypass the whole cervical canal and directly puts the sperm inside the uterus. Now IUI also, there are 2 types of IUI. One is IUI H, means whenever we do the IUI with the husband semen, it is IUI H, and another is IUI D. Whenever we do the intrauterine insemination with the donor semen, we call it as IUI D. In IUI also we are doing single IUI or the double IUI. When the patient is having difficulty, means egg is not rupturing at the 36 to 42 hours or at least by 46 hours, in such couple we do first IUI, and later on by after 12 to 24 hours later we do the second IUI. So success rate of IUI is around 12 to 20% per cycle, and whenever we do the cumulative cycles like 3 to 4 cycles, success rate increases up to the 30%. So the IUI is the first and foremost the basic procedure which we do in our fertility center, and the IUI is ideally suggested patient should go at the fertility center only. Why? Because semen and sperm are very sensitive gametes. So whenever somebody is taking sample and traveling and taking somewhere else, the motility, morphology and count definitely hampers. So my advice to you should couple, all infertile couple, at that you don't get disappointed whenever you are you find that okay, the adequate time has happened, now you want to conceive, you want a baby, then visit a fertility center, take the proper guidance, and according to the treatment option are there, and many couples all over the world are today having the healthy baby with the such type of treatment. So now it's not a taboo, it's not, infertility is not a disease, it's just that something is lacking in your body, and we are just helping you. So thank you all for listening me and giving opportunity. We'll be continuing this series. Thank you all.